So, unpopular OBGYN opinion loading, I do not like laboring down. So, I'm Dr. Toya, board certified OBGYN, and the evidence is a little bit conflicting on the benefits. But in general, based on most recent studies, laboring down is actually not recommended by ACOG. The benefits are minimal and there are significant risks with infection, bleeding, things like that. Because it's conflicting, a lot of people still agree that it's better to wait, especially for the patient to have an urge to push. But clinically, what I see happen, and I've worked at a lot of hospitals, I've been doing this for a long time, the patient is, say, at -1, like in this previous video, which is also a red flag if this is a first-time mom, right? So you have an epidural, the head is at -1. That's a little bit concerning. Now you labor down, usually for an hour or two, and one of two things or both things are going to happen. There are very little position changes or no position changes, and there's no assessment of the fetal station during that time. So you're going to start pushing after a couple of hours, and the head is still at -1. So now you've added on 2 hours to the second stage with really no benefit and only increased risks of being completely dilated for all those hours. Plus, the patient now has to start pushing, which could be several hours. And I like to prevent first-time C-section. So if you and baby look good, I'm going to encourage you to push for 3, 4, 5 hours. So imagine all of that time when you could have started pushing from the beginning, or do the interventions during the laboring down stage that's going to actually help the head come down. So it really depends on the patient, the support staff, and all of that. But I just have not seen enough benefit. And maybe patients that tend to have doulas or things like that, or more active nurse who is educated about the ways to get babies to come down, it would be beneficial. But I just have not seen that, and it would really need to be individualized. But in general, let's start pushing.